Are you confused about which weight loss injection is right for you? This video breaks down the most popular GLP-1 drugs like Ozempic, Wegovy, Mounjaro, and Zepbound. This video has 6 parts. I'll compare how they work, their effectiveness, side effects, costs, and long-term risks. By the end, you'll have a clear understanding of which might be the best fit for you or someone you know. First, in Part A I will compare the mechanism of action and briefly talk about how they work. In Part B, we will compare the effectiveness of these drugs by comparing their results on people who actually used them. Then in Part C, I will go through the side effects that you might experience if you use any of these drugs. And in Part D, we will compare the cost of these drugs, noting that they are quite costly as compared to other more traditional medicines. Then in Part E, which is the most important and most practical part of this video, we will discuss who should take what. That helps you select the right medicine if you plan to give these medicines a try. Finally, in Part F I will go through some important messages about the duration of treatment and some tips and tricks about stopping the drugs, because if you don't stop these drugs properly they can do far more damage than you can think. Let's start with Part A that explains how these drugs work. GLP-1 drugs have become the hottest topic in weight loss and diabetes management. They've helped millions lose significant weight, but not all of them are the same. Some are more powerful, some are approved for different conditions, and some come with unique side effects you should know about. How they work: all GLP-1 drugs work by mimicking a natural hormone that regulates blood sugar and appetite. They slow down digestion, make you feel full longer, and reduce food cravings. Mounjaro and Zepbound go a step further by also targeting a second hormone called GLP-1, which may boost weight loss even more. Ozempic, also called semaglutide, was first approved for diabetes, but patients noticed big weight loss. Wegovy is the same drug at a higher dose, officially approved for obesity. Mounjaro, or tirzepatide, showed even more dramatic weight loss in trials, up to 20% of body weight. Zepbound is essentially Mounjaro rebranded and approved specifically for obesity. What are the side effects and risks? The most common side effects are nausea, vomiting, diarrhea, and constipation, especially in the first few months. Serious but rare risks include pancreatitis, gallbladder issues, and a potential thyroid tumor warning. Another concern is muscle and bone loss with rapid weight loss, which can affect long-term health. These medications are very expensive if not covered by insurance. Ozempic costs around $900 per month. Wegovy is about $1,300 per month. Mounjaro and Zepbound range from $1,000 to $1,200 per month. Supply shortages are still an issue in many countries, due to increased demand in recent months. Now moving on to who should take what. If you have diabetes and need better sugar control, Ozempic or Mounjaro may be best. If you are overweight or obese without diabetes, Wegovy or Zepbound are FDA approved. If maximum weight loss is your goal, Mounjaro or Zepbound often work better. The big questions people ask is what happens if you stop. Most people regain much of the weight. Can you just take it short term? It works best long term, but stopping usually reverses results. Are there alternatives? Yes, lifestyle, other weight loss meds, or even future oral GLP-1 pills in development. So which GLP-1 drug is the best? The answer depends on your health goals, your medical history, and affordability. Ozempic and Wegovy are proven, while Mounjaro and Zepbound may be the future of weight loss because of their dual action power. But remember, these are not miracle fixes, long-term lifestyle support still matters. If you found this comparison helpful, make sure to hit subscribe because my next video will cover the rebound effects when you stop these drugs and how to come off them safely.